Good afternoon, everyone. My name is Ginny Larimore. I am the Director of Brand Management and Trademark Licensing, but today I'm very happy to be the host of this town hall. So welcome to the COVID-19 Faculty and Staff Town Hall. This session is intended to answer questions related to COVID-19 protocols and the fall semester. Many of our faculty and staff across campus have been working diligently since the spring semester to prepare the university to be able to open as safely as possible. While the university cannot totally eliminate the risk associated with COVID-19, extensive measures have been put into place to protect our Bengal community. The COVID-19 protocols and measures have all been carefully developed based on CDC guidance and in close coordination with our local health department. This has been a heavy lift, but we have responded as comprehensively as possible. A required faculty and staff training video was sent out this week, aimed to ensure that every faculty and staff member understands COVID-19 protocols and their responsibilities in keeping themselves and others safe. A similar one is being developed and sent to students. We will also be sending out a campus mailer to all employees with quick reference reminders that cover what you should do if you or others are ill or exposed to COVID-19. Please remember, as we move forward, to check the Roaring Back website at isu.edu/roaringback regularly. Important information will be posted here as the situation evolves. Now, all the work that the university has undertaken this summer has been coordinated by 5 committees. These are called our Roaring Back committees. Today, we are joined by the chairs of those committees and our Executive Vice President and Provost, Dr. Laura Woodworth-Nye. The Employees Operation Committee is chaired by Katie Thomas, Associate Director of Human Resources. The Student and Campus Services Committee is chaired by Dr. Craig Chatron, Dean of Students. The Instruction Committee is chaired by Blake Beck, Director of the Instruction Technology Resource Center. The Community Committee is chaired by Chris Boyce, Director of Emergency Management. And the Health Committee is chaired by Dr. Rex Forrest, Senior Vice Provost and Vice President for Health Sciences. We have a number of questions that were pre-submitted. We'll be asking those shortly, and we'll leave any remaining time for a live Q&A. In the meantime, feel free to submit any questions via the Zoom chat feature, and I'll send a chat now to everyone with those instructions. Additionally, if you're watching our live stream on YouTube, you can submit questions via live chat. And I also wanted to mention additionally that we have Sarah Spellman with us, who will be interpreting today's town hall. Now we'll turn things over to our panel for our pre-submitted questions. First, we would like to address a couple of our most frequently asked questions, and then we'll move into some of the specific questions submitted during the last town hall, and then questions submitted live today. So the first question today, this will go to Laura. And first, we would like to address why the university is moving forward to offer in-person instruction, given the rise in cases, especially when the case prevalence is much greater now compared to last spring. And in addition, why is the university exempt from the guidance that large gatherings should be limited? Laura?
Thanks, Ginny. First of all, I want to thank everyone for joining us for another town hall. We recognize that we've had a lot of these, and we really appreciate your participation in them. And I want to welcome the faculty back to campus as well. This is our first contract week, and it's unlike any other contract week we've ever had. So welcome back to campus. And with that, I will answer the question. Although we can never mitigate all risks, we are in a very different position than we were in the spring when COVID first became an issue. We have implemented over the summer, as Ginny mentioned, proactive and precautionary risk mitigation efforts to promote the health and safety of faculty and staff and students, of course. Education, including higher ed, is deemed an essential service, and many of our students have told us in surveys and in other data that in-person instruction is important to them, to their decision to enroll in a university education, and also those programs that we have that have face-to-face components that are required for licensure. We're doing everything possible to keep those face-to-face as well. With all the measures that we have in place, from high flex, distancing, face covering, sanitation, and health plans, we feel confident and that we've done everything we can to make the environment as safe as possible. I can give you an idea of where we are with our class breakout right now. There's been quite a bit of information sent out about our different class types. I'm combining some of those here for the purposes of simplicity. Right now, 21% of our total classes are online. 26% are high flex. And if you joined us last week, you know that the transition to high flex is the big difference between our schedule in the past and our schedule now. And then 15%, about 15% are traditional in-class lectures in classrooms that have been socially distanced. The remainder are labs, about 7%, and then 31% for dissertations, clinical rotations, and thesis courses. As I mentioned, we've implemented many health measures that will allow us to move forward with these course types. The rerooming effort, for example, has significantly reduced the capacity of our face-to-face courses. Currently, the average course size for ISU's 100% face-to-face sections is 13 for face-to-face, 12 for lab sections, and 13 for high flex. And I received those numbers this morning. Now, of course, we have sections that are larger than that because that's the average. And we have some very small sections that are pulling that average down. So it's possible that many of our sections are on both of those trajectories, larger and then very small. But the average we expect, even after the registration that's occurring right now, will be around 15 at the upper end. So overall, we are well positioned to offer limited in-person instruction. That said, adherence to our protocols is essential. But if campus community members adhere to the public health protocols, the risk of transmission is very low. A 0% transmission cannot be guaranteed, of course, but we are doing everything possible to keep it low. And we will also be monitoring the health environment as we go forward if we need to make any adjustments. Thanks, Ginny.
Thanks, Laura. Next, we would like to share some information related to our plans if COVID-19 becomes widespread on campus and how we will shift from the operational levels we have developed. And I'm going to send this one back to Laura.
Thanks, Ginny. The university has worked very diligently over the summer to develop a framework of public health metrics that correspond with 4 different operational levels. These metrics cover both community and regional infrastructure, as well as our own university-specific metrics. The Health Committee reviewed extensive literature and higher ed best practices to arrive at these metrics. They focus on infrastructure, caseload, and response capacity. The metrics are reviewed on a weekly basis and provided to the university's administrative council, which is composed of the university vice presidents and the president, who make a decision regarding moving between these operational levels based on the data. And Ginny, maybe we can share out the link to those operational levels.
You got it. I'll post that right now. Okay, thanks, Laura. Next question. We want to move into covering what you do in the following scenarios. So what do you do if you have COVID-19 symptoms? If you have COVID-19 or symptoms of COVID-19, what do you do if your employee does? And what do you do if your student has symptoms? And for this, I'm going to turn it over to Rex.
Thanks, Ginny. Hi, everybody. Ginny, are you hearing me okay?
Yes, sounds great. Thank you.
Okay, great. So we have some slides to walk through here. We also have the training video that Ginny referred to earlier. In addition, all of this information is posted on the website, so it's available to everybody. If you have symptoms of COVID-19 or test positive for COVID-19, obviously you need to go home immediately and isolate. We have an online reporting form at www.isu.edu/roaringback that we would like folks to fill out. That will engage our contact tracing process, as well as folks that can provide you with education and answer questions. We think you should notify your supervisor of any areas on campus that you had close contact with other individuals. And supervisors can mail this information to covid@health.isu.edu. Note this email structure is a little different than our typical emails. It has the @health.isu.edu because it's a secure email for dealing with secure information. Supervisors should not notify other individuals of the suspected cases or confirmed cases without direction of the health committee. The health committee, and working hand in glove with the health department, will do all the contact tracing and will maintain the appropriate measures of confidentiality that need to be in place in this kind of a process. You should then contact your primary care provider and determine if you need testing for COVID-19 and follow those recommendations. If you don't have a primary care provider, our University Health is available to provide you with guidance, and we have testing capacity on campus. We can talk more about that later. You should also participate in any contact tracing that occurs with the health department or with the institution and follow recommendations that are provided by those contact tracers or the university COVID-19 health committee. Next slide, Ginny. If you're a supervisor and your employee reports symptoms of COVID-19 or test positive, if the employee is on campus, they should go home. They should go home and isolate. If that employee declines, we should have a facilitated discussion with them on the rationale and try to help resolve their concerns and still push them to go home. We don't want to have additional exposures on campus. If the employee still declines or you're having a difficult time negotiating this, you should contact HR for further instructions. And that employee should, as we talked about on the previous slide, report their illness by completing the COVID-19 self-report form on the web page. If you're concerned that the employee did not complete the form, you can contact our hotline and or use the email. So on the slide there, it's covid@health.isu.edu again, or 282-2705. And what we will do is help you with follow-up. Again, this team is closely integrated with the health department here on the Pocatello campus, and will walk you through and walk the employee through the process. Again, we don't need to notify other employees or units about the suspected illness without direction from the health committee or the health department. And we will work with the supervisor to do that contact tracing, provide follow-up notifications for colleagues and students and individuals who may have had contact and then need to take additional measures such as quarantine and so on. Next slide. So this is a continuation of the previous, again, talking about an employee. The supervisor should email the following information to the covid@health.isu.edu email. Prepare a list of individuals that the ill individual had close contact with in the 72 hours prior to symptom onset. That's the infectious period that is possible before people demonstrate symptoms. Close contact, and this is important, and this is what the health department and the COVID team will work with you on. Close contact is defined as being within 6 feet of someone who has COVID-19 for at least 10 minutes. And that person does not need to have symptoms. Remember, you've heard, I'm sure in the press, a lot of people don't have symptoms but still test positive. They are still infectious. And so anyone who has symptoms or who has tested positive can transmit the virus to others. Typically, it needs to be in this kind of a close proximity within 6 feet of an individual for at least 10 minutes. If the employee was on campus while symptomatic, we generally are going to recommend that you close the workspace and contact facilities for cleaning. And we encourage the employee to contact their primary care providers we talked about before to determine their need for testing and following those recommendations. And obviously, for us to get on top of this, everyone who has COVID or is suspected of having COVID needs to participate in the contact tracing process with the health department or the COVID health committee. Next slide. So what if you're a faculty or a staff member that has a lot of contact with students and your student reports symptoms of COVID-19? If that student comes to class, if someone is obviously ill, we need to send that student home and ask them to either attend class online or make arrangements to provide the makeup work for that individual student. The student should be instructed to report their illness on the COVID self-report form again. And if you as the faculty member are concerned that the student didn't complete the form, then you can contact the COVID hotline or the COVID email. Again, we're not recommending that we notify the class or other students about suspected illness without direction from the health committee. One of the reasons we've decreased the density of our class and mandated face coverings is because that's a very effective public health measure. Just because you are in proximity of an individual or in a classroom with an individual doesn't mean that you're a contact based upon those definitions I provided earlier. So the health committee will help determine who needs to be notified in each individual incidence. And the committee will work with the faculty member and the local health district to do the appropriate contact tracing and follow-up and notification of others during that process. Next slide. So the faculty member should email the following information to the COVID hotline, to the COVID email. They can prepare a list of other people in the classroom and learning environment. One of the things that we've talked about in other town halls is having a seating chart so that you know who's in class and where they're sitting. That's very reasonable for us to do in these classes. And we need to understand the relationship and the contact with the ill individual for the 72 hours before symptoms began based upon their time in the classroom. Again, close contact is defined within 6 feet of someone for at least 10 minutes, whether or not that individual had symptoms or not. The faculty member should email that information to covid@health.isu, and the health team will be in touch quickly within 24 hours to provide additional next steps and guidance. If the student was in class, close that workspace, contact facilities, and we will initiate cleaning and disinfection. And again, encouraging self-report, encouraging the student to contact their provider and come up with a plan for testing and follow-up care is extremely important. Next slide, Jenny.
Hey, Rex, I am going to pick on you for this answer as well.
Okay.
What happens exactly when an employee, student, or faculty member tests positive for COVID-19 or is symptomatic? And will faculty be notified if a student in their classroom has tested positive for COVID-19, and will the other students be notified?
So it's a really good question, and obviously part of this is dealing with the confidentiality issues around both FERPA and HIPAA and protected health information. But when the university learns of a confirmed or probable case, we will begin a contact tracing process. And the University Health Committee, in coordination, as I said, with the district health department, will help to identify anyone who has had close contact with the individual. That's why we want to know about these cases right away. Again, close contact is defined as interaction within 6 feet of someone who has COVID-19 for at least 10 minutes. All the individuals that meet the criteria for being in close contact will be notified of their exposure. That's the role of contact tracing. And we'll be giving you guidance on next steps. In many cases, the health committee will contact the instructor to gather information about the format of the course on the days that the student or other individuals who were potentially infectious were present. So we encourage students to reach out to their instructors and let them know if they're ill or exposed and make arrangements for missing class. make arrangements for makeup work and class activities while they're in isolation or quarantine. And if this occurs, the instructor should email information about that to that covid@health.isu email and wait for instructions from the health committee before making other notifications in the class or department. There may be situations where an instructor is not notified that a student in their class tested positive. An example of this might be if the student was participating remotely and there was not an actual exposure in that 72-hour time window we talked about. So if they weren't present in the classroom during their infectious period, we may not be notifying the class of that possibility. But if it's within that window, if there's any concern about that, contact tracing will kick in and we'll begin the notification process. The campus community should be, I think, absolutely assured that the process is in place to do contact tracing and do notification for all those that are exposed will be done. And that's why engaging the COVID health team will create that safe environment that we desire on campus here.
Great, thank you, Rex. Okay, so now we're going to move into the questions that were submitted during last week's town hall, but not yet addressed. And then after that, we'll move over to the live Q&A. And any questions that are not covered in the hour-long town hall today, I will personally get the answer for you and give it to you. So if your name on Zoom doesn't equate who you are, just please let me know your email address so that I can get that question answered for you in case it's not covered today. Okay, so first question that was submitted last week but not yet addressed. In walking through Reed Gym, I noticed athletes working out without masks. Much of the coaching staff were also not wearing masks. They were also walking from the locker areas without masks. This sets a bad example. Is there a separate policy for athletics? And for this answer, I'm going to turn it over to Craig.
Thanks, Ginny. Good afternoon, everybody. All of our faculty, staff, and students are expected to wear face coverings on campus. There are no exceptions for any specific groups of students, staff, or faculty, unless, of course, somebody has a medical reason that they're not able to wear a face covering. I also had a couple people mention to me that there are some athletes not wearing face coverings. And I chatted with our administrators over in the athletics department, and I'm positive that as these types of issues come up, they're going to do the education needed, and we'll see compliance moving forward.
Great, thanks, Craig. Next question. Are we going to know the metrics for closure in the event of closure? And I'm going to turn that one back to Rex.
Sure. Thanks, Ginny. The COVID health team has, and I think the provost mentioned this in her initial comments, has spent a great deal of time looking at best practices and guidelines for keeping campus open or moving to a different operational level. The operational levels that we're going to be operating under are on the website. The metrics that we utilize to move between those operational levels are reviewed each week and even more frequently as necessary by the COVID health team, and then we provide recommendations to, or a scorecard in essence, to the admin council for them to then make the decision as to what operational level we're at. The metrics that are out there are widely known. They are commonly utilized metrics for looking at disease activity. This includes what is the state of affairs in our community or our public health district? What's the operational level recommended by our public health district? What are the trends of cases that are occurring in the community? Are those trends going up and down? What is the testing capacity in the individual communities? And we look at these for Idaho Falls, Pocatello, and Meridian. We also look at the operational status of our partner institution at CSI for our Twin Falls campus and for the University of Alaska Anchorage for our pharmacy cohort up there. These different metrics are also include how are we doing on campus? What are the number of cases here? Are we dealing with clusters? What's our capacity to care for students in places like University Health? What's the status of other essential personnel, for example, cleaning staff and that sort of thing? And how well are we doing with wearing face coverings on campus? How much personal protective equipment do we have for health operations and things like that? What is the level of absenteeism on campus? These are the kinds of metrics that we look at, and we come up, as I said before, with a scorecard and make that recommendation to admin council, or that score to admin council.
Thanks, Rex. Next question. Where can instructors see how many students are allowed to physically be in our classroom at one time? And for this answer, I'm going to turn it over to Blake.
Thanks, Ginny. That's a very good question. I've asked Ginny to post a link to a spreadsheet in the chat box that has all of the classes with their COVID capacity. The term we've been using this summer is what's the COVID capacity in these rooms. If you need that link, you're certainly welcome to email me as well. There's an Argos report that's available with room capacities and number of students enrolled as well out there. There was a notice that went out to department schedulers and chairs at the end of July from the registrar's office that had the link to that. But if you've got access to Argos reporting, you can look at that. And we're actually trying to get another communication out this week again with this same link to the spreadsheet in it that hopefully everybody can see that. But if you have specific questions, feel free to contact me directly.
Thanks, Blake. Next question. Understanding that cases on campus likely correlate with potential exposures and thus 2-week quarantines for instructors and classmates, what is the expectation for in-person classes given the likelihood of individual class quarantines? And for this, I'm going to turn it over to Craig.
Well, when there are positive cases on campus, our COVID health committee is going to work with our public health department, just like Rex has described. There's going to be a number of factors that's going to impact the next steps. Number of people exposed and that type of thing. But our health committee and the public health department are going to take the lead in doing contact tracing and making recommendations for any individuals or if we needed a large group to do any type of quarantining. We're asking our community to be as flexible as possible this semester, knowing that we might have to make adjustments. In the event that an in-person class should be moved to an online mode, our health committee is going to be the one that's going to help make that decision and help a professor move it into that mode.
Okay, thanks, Craig. Next question. Would you consider testing students and/or faculty that will be coming back from out of state? I know it has been mentioned that they should quarantine for 14 days before coming back to campus, but would it be more advantageous to test these individuals? And for this answer, I'm going to turn to Rex.
So it's a great question, and it's a complicated answer. We absolutely have considered this kind of an approach. One of the issues that has come up is the availability of testing supplies and the turnaround times of those tests to be able to make them, to make the information usable. Right now in Southeast Idaho, for example, we have about a 5-day turnaround for tests. We are recommending that students self-quarantine before coming to campus. Obviously, one of the most important things in all of this is if people are feeling ill, that they should stay away from campus, right? They should either stay at home and come to campus late if it's right now, and they're expected to move into the dorms, or if it's an employee, anybody who feels ill with cough and cold symptoms should be staying at home and contacting their supervisor. Widespread testing is difficult to interpret. There are occasional false negatives, so people fall through the cracks. And we don't have the resources available to us to implement widespread testing with rapid turnaround to be able to make this an actionable approach to decreasing disease activity. The other thing that we should remember is that Idaho is really one of the worst 10 states right now in terms of disease activity. So in many cases, people coming from other locations may be coming from an area of lower disease activity to one that's higher here in Southeast Idaho, or particularly in the Treasure Valley, where disease is even more active right now. So it's a complex answer. We have considered that testing. We are in the middle of ramping up our testing capacity in Southeast Idaho, and I'd be happy to answer more questions about what our testing capacity is, moving forward.
Thanks, Rex. And I'm going to hang on to you for this next question as well. We're currently required to quarantine for 14 days coming from travel to high-risk areas. Are we requiring students who are coming to ISU from high-risk areas to quarantine before coming to campus?
So I kind of touched on this answer already. We're asking students to quarantine before they come to campus, just because we want to limit the possibility of spread. Now, that's a voluntary activity. We know that people are, traveling in some cases. They may be working right before they come to campus, and so it's a difficult time for people to truly be quarantining. But we have asked for that for people that are coming to campus from high-risk areas. It's sort of related to the other testing question. There are some that will fall through the net. There are some that will be non-compliant, but we absolutely have made this part of our messaging.
Thanks, Rex. Next question, when will telework end and classified employees be required to be working from the office 100% of the time? And for this question, I'm going to turn it over to Katie.
Hi, good afternoon, everybody. So yeah, that's a good question. And unfortunately, we don't know the answer to the question at this point. So we will continue to follow CDC, state, and health district guidelines. And currently those guidelines do still include things like physical distancing, additional precautions for high-risk populations, continued remote work where possible, and rotating staffing in many areas, which reduces exposure. And these elements, I think we can be used to them being part of our new normal for the time being. And they're even included in the yellow and green categories and the operational levels that we have within the university. So I think we can anticipate these changes being in the workplace for a while, and unfortunately we don't know when it's going to change. That said, each department has worked with their leadership and teams in their own areas to create whatever staffing plan best meets the operational needs of that unit and the university. And these plans may need continual assessment and revision as new work operations are monitored, or in some cases, certain offices get busier at certain times of the semester and you may see staffing fluctuate. But if you have a question about a particular area or on your team, my recommendation would be to talk with your supervisor about your specific area and ongoing staffing plans and telework, what they anticipate within a specific area.
Okay, thanks, Katie. Next question, the operation level PDF looks like it only shows the level of Pocatello. Rex mentioned Meridian is in the red level, and this of course was at the last week's town hall. Is there a place to find which level each campus is in? And I'm going to turn this to Rex.
So I want to clarify that statement about Meridian. The Meridian campus is not in the red level, but the district health department has really ratcheted down the community, limiting group size and having a mask mandate and that kind of thing because of the disease activity there. The operational levels will be determined for all of our campuses. We will be utilizing a green, yellow, orange, and red system for Pocatello, Meridian, Idaho Falls. Our campus at CSI in Twin Falls will sort of follow what CSI is doing because we're highly dependent upon their operations. And the same will be for our campus in Anchorage, Alaska, on the campus of the University of Alaska, Anchorage, because we're so highly dependent upon their operational activities. It will be determined by them. We'll parallel our operations with what's going on there.
Okay.
And it will be on the website, Ginny. We will have that. We will have that operational level for each campus on the website.
Great, thanks, Rex. Next question: how are we supposed to not tell we are sick to other faculty/students when we might need somebody else to cover our classes or to move our courses on Zoom for the duration of the isolation? And I'm going to turn back to Rex for that.
Well, I would encourage people to communicate to the level that they're comfortable with. And certainly to cover the work, we need to communicate with our supervisors and with our colleagues. And so if people are going to be out of work for an extended period of time, either because of exposure and subsequent quarantine or true actual illness and isolation, we should be communicating that. When it is reported, as we talked about the processes earlier, when it's reported through the self-report form, the COVID health team will help to coordinate this communication as well.
Thanks, Rex. Next question, what does an employee need to do if their spouse or family member they live with has been tested for COVID but are waiting on results? Does the employee have to quarantine? And Rex, I'm going to hang on to you for that one.
So they should, if someone in the family is being tested or a roommate of a student is being tested, they should follow the guidance of the public health team. And so in any of those cases, we're available for consultation with the COVID health team through the hotline, through the email, or the self-report form to be able to provide you with guidance. In general, if there's been an exposure, people should be conservative and should not be coming outside of the household environment because of risk of transmission.
Thanks, Rex. Next question. If we are exposed to someone else who tested positive and we have to quarantine, can we still work from home? Or if we are isolating, tested positive, and feel well, can we work from home to avoid running out of our sick leave? And I'm going to turn this over to Katie.
Yeah, good question. Yeah, if you have to quarantine or self-isolate, but you're still able to work remotely, you're definitely able to continue working remotely rather than using leave. So if remote work isn't a possibility, you as an employee, any employee should work with their supervisor and HR to identify what the most appropriate leave option is for their situation. And there are some specific COVID-related leave options for times of illness and caring for others, and if you are at home for isolation or quarantine. But yes, if you are isolating or quarantining at home and are still up for working remotely, you can work that out with your supervisor and continue to do so.
Great, thanks, Katie. Next question, given the huge amount of misinformation regarding COVID-19 and the health implications, is ISU going to put together a document that outlines exactly what the medical research is finding regarding masks and health risks? For example, 50% of asymptomatic cases are showing lung damage that may be permanent. I'm envisioning a document with citations. I'm going to turn this over to Rex for that answer.
So there's no question that there's a ton of misinformation out there. And it seems like there's been almost an information war about what's true and what isn't true. And we're learning more and more information every single day. So what we know to be true today may not always be true tomorrow. And that's the nature of science in a rapidly evolving area. We are looking at, as we get a little more settled with our policies and procedures and contact tracing and all the other work that we've been doing, we are looking at putting together a document that will kind of provide the best evidence on some of these topics. That is the disease severity, the utility of face coverings, et cetera, et cetera. You know, we have to remember we're an institution of higher learning. We deal with facts, we deal with the scientific process, we deal with the quest for truth, and we can help to support that. We will definitely do something like this to be able to provide the campus with the best possible information.
Great, thanks, Rex. Can you talk to us about situations in lab environments where 6-foot distancing is near impossible to maintain?
Sure. You want me to take that one, Jenny?
Yes, please, Rex. Thank you.
So we have worked very hard with some of the health exceptions that have come in, and they're exactly like this, right? People are working close together. They're working on equipment. They may be working with computers. They may be working in a simulation lab. And so there are situations where people will violate, if you will, that 6-foot distancing requirement that we have in virtually all of our classrooms. In those situations, we have had exposures, and we've had to deal with those exposures and then put people on quarantine and follow up. I can tell you that over the course of the summer, when we've had those exposures, our use of face coverings has been very, very effective. And so in that setting, when we may violate the space or the dimension criterion, we still want to make sure that we're doing everything else in terms of disease mitigation activity. That includes wearing our face covering, frequent hand washing, covering sneezes and coughs and that kind of thing, and making sure that we're just limiting the time that we are in close proximity to one another. We had the question come up before, well, is that time cumulative? The answer is yes. So if I spend 2 minutes with a person in the first part of the class and 8 minutes with the person, the latter part of the class, that 10 minutes is cumulative. And so we have to minimize the time that we spend within that 6-foot bubble and maintain all of the other disease mitigation activity to try to mitigate any disease spread. That being said, if we have courses where we can't maintain that distance and can't utilize face coverings, we need to see those through the health exception process, and the COVID health team can provide you with some guidance in dealing with that situation.
Thanks, Rex. Okay, so a lot of the questions that are coming in, quite a few of them are related to this same question, which is how can we go about, or how should we go about encountering someone who is not wearing a mask? So let's say it's a student in the public spaces like student union, or if there's a student in your class, what is the protocol for employees in that case? And for the first part, I'm going to turn it over to Craig. What do we do in general? And for the classroom, I'm going to turn it over to Blake. What should faculty members do?
Yeah, it feels like a lot of us have spent a good chunk of the summer answering questions about the wearing of face masks and face coverings. This is going to be a community issue. We haven't organized a group of staff who are directly responsible for enforcing face covering use, but it's really something that all of us have a role in. We have a role in setting a culture and setting an example of wearing our own face coverings anytime we're on campus. But any one of us as a community can ask someone to put a face covering on. If you see somebody in the student union, or if you see somebody in a study room or in a hallway not wearing a face covering, it's more than appropriate for you to ask them to put one on. Now, it's going to be important how you ask them to do that. And so we're going to ask you to have a lot of compassion for people. We're going to ask you to use a gentle tone. A lot of the questions that I've been getting about face coverings seem fairly intense. And I think that's because people are tired, people are nervous, they're scared. And I think the face covering issue is one of the ways that comes out. So as you talk to other people and as you approach somebody to ask them to put on a face covering, have some compassion, use a gentle voice, and make sure it's a request. It's about the community and keeping all of us safe.
Thanks, Craig. And then I'll bop over to Blake to discuss how faculty members should handle this situation.
Okay, that's a good question. There is a resource that's been distributed called the Faculty Toolkit, I think is what it was called. I don't have the link to that, Ginny, sorry, but that's a good resource for how faculty can respond. But just to kind of summarize a couple of key points in that. First, there are disposable face coverings available for every faculty member to have some with them. So you can request those from the Bengal Depot. So first, if a student shows up without a face covering, certainly can offer them a disposable face covering and request that they bring the one that they've been given, or one of the ones they've been given to the next time. If a student continues to refuse to wear a face covering, certainly another invitation could be for them to participate remotely. With the flexibility we've built into the schedule this year, there is a lot of flexibility in most every class. And so that would be, assuming that you have that in your class, which again is most of them, invite them to just participate remotely. If that continues to be a problem as well, and they continue to show up, then the next recourse is probably to refer them to the what's it called? The Student Discipline Committee. That's not what it's called. I can't think of the name right now, but I think you probably know what I mean when I say that. And you certainly can, if it's making you or other people in the class uncomfortable, you could suspend class. You could run it all remotely for a time until it is resolved with this particular student that's causing this problem or something like that. That's another option to think about. So I think that would be, I don't know, Laura, if you have any more you would want to add to that or not, but I think that's my summary of that toolkit document.
I think you've summarized it, Blake. One of the questions I've been receiving is if the course, more than one student is not adhering and it is difficult for the faculty member to manage, we have advised faculty members that they can move the remainder of that course content online, but just making sure that students have access to it in an asynchronous environment, because it will be outside of the norm for that course. And just keeping in mind that we want to support the students who are adhering and have been following protocols. And certainly, as Blake mentioned, anytime you run into concerns or if you're feeling uncomfortable, you certainly can contact Student Affairs to help with that specific student or students. And Craig might want to add to that as well.
Yeah, feel free to contact Student Affairs or the Dean of Students office, and we'll work with you in each case individually, and the goal will be to resolve whatever conflict is present. And I think we've built a flexible schedule, and so we can offer students a lot of different ways to participate in our classes. And if they're not willing to wear a face covering, then we're going to ask them to participate online and not be present on campus.
Related to this conversation, what should an employee do when a whole department, like the maintenance department, for example, is not adhering to the face mask policy and social distancing? And for this, I'm going to turn it over to Katie.
Okay, yeah, thanks. So I'm going to echo what both Blake and Craig have already started to share, which is that we want everyone on campus to feel empowered in reminding others, whether staff or student or member of the public, about our campus face covering requirement. But we are asking, as they have both mentioned, to do so in a kind and respectful way. So you can feel free to approach anyone with a polite reminder, direct them to a location where disposable face coverings are available, if you're comfortable doing so. And then if the individual is an employee or student and they indicate that they're medically unable to wear a face covering, because there are some people that fall into this category, then we can refer them to disability services or give them a heads up that they could chat with disability services where they can discuss accommodations for the situation. And this is a safety requirement, and it's a matter of public health. So like any other campus safety requirement, if an unsafe behavior continues, feel free to follow up with a director or supervisor of the department to discuss your concerns. Similar to the document that Blake referenced for faculty, we put together a supervisor toolkit to help supervisors have conversations with their employees regarding the use of face coverings. And so it's basically approaching the same approach, discussing, educating, making sure they're available, discussing certain situations, how we can adjust things accordingly, but the option isn't to just skip wearing a face covering. And if the supervisor needs additional support, they're always welcome to reach out to HR, and we can discuss on a case-by-case basis and find some solutions. And I know this isn't easy, and I know we all wish this virus would just go away and we didn't have to wear face coverings. But while we're dealing with this together, we just please ask that everyone use kindness and respect when engaging in this conversation and these kinds of conversations.
Thanks, Katie. So switching gears a little bit, when recording lectures, do we have to create a YouTube channel, or can we save the recordings in a Google Drive folder, which the students have access to? And for this answer, I'm going to turn to Blake.
Okay, thanks, Ginny. So the options for recording a Zoom lecture are either to save it locally to your computer, or to save it using the streamed YouTube channel that was described in a Tiger Tracks article and some communication that's gone out to faculty, a training video that was prepared. Ginny, if you wouldn't mind posting the link to that. So I'm assuming that when you say put it in a shared Google folder, we're talking about saving it locally and then moving it out to the Google folder. And that certainly can be done. The dilemma with that, or the challenge with that, is simply that as you close a Zoom session, the video will start to convert. It, I think, is the terminology that it uses. And sometimes a video can take 10 plus minutes to finish converting. So before you could actually have that file to move to a Google folder, if you're in a shared classroom, say the Rendezvous, and there's somebody else coming in right behind you and they're trying to get set up, there may not be time for that video to convert completely. If you're using your own device, you're on your own laptop or whatever, then that's going to be fine. It's really an issue when you're using a shared machine and somebody else is going to come right behind you. Because as soon as they start their Zoom session, the conversion of yours stops and you have to come back and manually restart that. And that can be done. And if you call the ITRC, we can help you, show you and help you understand how to restart that to get that file if that does happen. But that's the challenge. And that's why we're recommending either to do the YouTube channel, the streamed YouTube channel, excuse me, rather than the local and then moving it to a Google Drive, just because we don't know if it doesn't matter where you are in any environment in that case, like I said. So those would be the issues I would say to keep in mind. There's nothing wrong with a shared Google folder for putting that file in, and if you're in a situation where you can do that, that would be fine.
Thanks, Blake. Okay, next question. I'm going to pop over to YouTube and get some of these questions answered. The first question, how long after cleaning can people be inside the room? Katie, can you answer, or tell me who should answer that one?
That's a good question. And I don't know the specifics of the cleaning chemical. And I don't know that we have Cheryl on the call today. I can certainly reach out and get more information from her regarding the specific procedures. I've talked with her a little bit about what needs to happen on the front end as far as closing off a space for 24 hours and then doing the cleaning. I know one of the machines that they have is a fogging machine that does a sanitization of an entire space. And they will post, so if they're using that machine in any space, they'll be posting on the door of the space for the time period that it's closed, and then opening it back up once it dissipates. But I don't want to state the wrong time, so I'll just stop there and I'll follow up with Cheryl to get more specific answer.
Perfect, thanks, Katie. Okay, next question. Will academic advisors be notified if a student tests positive that has been in our office, as most offices do not allow 6 feet of distancing and lasts roughly half an hour? Craig, would you mind answering or putting that in front of the right person?
Sure. And I'm going to ask Rex just to make sure that I give the right answer. But if a student tests positive, we're going to do the health district and our COVID health committee are going to do contact tracing. And so they're going to look at everyone the student had contact with prior to testing positive. And Rex covered the definition of contact a little bit earlier. And so if you were in a space with a student for a half hour where there wasn't 6 feet of distancing, then you would most likely be contacted during the contact tracing period. I also want to remind everybody that while we're trying to be present with students, if there's times where you can't be 6 feet away from students, please continue to use Zoom to have meetings with students if appropriate.
So Craig, you're absolutely right. Contact tracing requires that kind of recollection from the individual. So over that time period that they could potentially be infectious, identifying every possible contact, where they were throughout the days, so that we can then have the right kind of education and intervention with those that individual came in contact with. But your answer was spot on.
Thanks, Craig and Rex. Next question. This is actually a statement and then a question from one of our students. The statement is, I just want to thank all Idaho State University staff and faculty for giving us students an opportunity to come back. So thank you so much. And what they want to ask is how finals are going to work. And so for this answer, I'm going to turn it to Laura.
Thanks, Ginny. And Blake can correct me if regarding proctoring, but our finals week is now a week earlier. We have calendar information out there about this. It is the week after the Thanksgiving holiday, and it will be virtual. This will be a virtual finals week. Faculty members are in the process of identifying how those finals will be managed. Some will be synchronous at the same time as the course, some will be asynchronous and at home, and some will be proctored. So work with your faculty member, make sure that if you are unclear about that finals protocol for the course, that you ask about it, and it should be posted in Moodle, certainly as we get closer to finals week. But faculty members have been working on how they're going to handle finals. And Blake, did you have anything you wanted to add to that?
No, I would just say that online proctoring is available. We have contracts in place and capacity available. We're a little better situated this semester than the scramble we were in at the end of spring. But if any of you as faculty want to use that, it's available. There's no charge this semester for that. The university is covering that as part of our COVID actions that we're taking. And I would just suggest that it's probably a good idea, if you are going to use proctoring on a final, that you do at least one test before then, maybe a lower stakes test, to help students get comfortable in that environment. So that would just be one little piece of advice I would throw out there maybe.
Great, thank you. Next question, are face coverings required on campus outside when a 6 foot or greater distancing can be met? And for this answer, I'm going to turn to Katie.
Yeah, sure, I can answer that. I know this can be confusing. So the goal is to use face coverings to reduce airborne transmission and the movement of droplets, and that's the ultimate goal. So it varies a bit depending on the situation. And I know you've heard Rex talk a lot. A lot of this is very case by case. Everything related to this is very case by case because there's situational questions with everything. So for example, if you're talking and walking with someone else, or engaged in vigorous exercise, you're expelling more droplets than when you're walking totally isolated by yourself. So our guidelines, the way we're stating it, is that they're required when outdoors in the proximity of others. So if you're away from others and easily able to maintain a physical distance of 6 feet, like you're walking alone on an isolated sidewalk or through an isolated area from your car to the building or something like that, you don't need to wear a face covering. However, if you are walking and talking with another individual, even if you're 6 feet apart, or you're walking on a sidewalk in an area where you're passing by others or it's congested or often congested, then we are asking that you please wear your face covering.
Thanks, Katie. Okay, I'm afraid that we have met the hour. That was really fast. If you have asked a question on Zoom or YouTube today and we haven't covered it live, I will follow up with you offline. So you'll get an answer from me within 48 hours. And if you submitted a question via our question form that went with our town hall announcement emails, since that was anonymous, please email me your question and I will get that answer for you, again, within the next 48 hours. And if you additionally think of a question later, I can help direct that answer to you as well. So feel free to reach out to me for any of those reasons, and I will be following up. And I just want to say thank you to all of you for attending today's COVID-19 Town Hall. And I want to thank each of our panelists for spending the time that they've spent with us today and continuing to work so diligently to keep us all safe. So thank you all so much. Hope everybody has a great rest of your day.